Welcome to Swine Cooperative Agreement Training. I'm Nikki Humphrey, a senior staff veterinarian with swine staff. In addition to myself, Dr. Lisa Rochette, Dr. Cody Egner, or Dr. Lynn Walkman can assist with answering your swine cooperative agreement questions. When you're looking at your swine program surveillance, please focus on the risky populations of swine, so your outdoor raised, fair pigs, any that could have potential contact with feral swine or move around frequently, and then your garbage feeders as well. We'll be talking about pseudorabies and swine brucellosis targeted surveillance today, followed by African swine fever and classical swine fever combined hemorrhagic program surveillance. We'll have a brief discussion on the Swine Health Protection Act search and enforcement, and then finally finish up with foot and mouth disease, Seneca virus A, foreign animal disease investigation pressure points. This graph depicts 1987 versus 2012 swine operations in the U.S. And you can see over time the industry structure has really changed to shrink the number of producers overall. First, we'll take a look at the number of operations in 1987, which you can see surpassed 240,000, almost 250,000 operations. Relative large percentage of these operations were medium and small operations, versus more currently in 2012, the number of producers was around 60,000, which shows an overall 75% reduction in pork producers in the U.S. And you'll see that the majority of the producers are in the small to medium-sized operations, and the larger producers make up about 10,000 operations overall, which is pretty similar to what the 1987 numbers were. Inventory has risen from about 50 million to about 65 to 70 million swine now, and a large portion of the inventory is in our larger producer herds with over 1,000 head at these operations. These operations that are larger typically have better, if not robust, biosecurity. So most of the risk that we foresee is in the smaller herds, where there are obviously a lot more producers. These herds have a tendency to have feral swine exposure or potentially lower biosecurity implementation. And these are the herds that we want you to target for your surveillance. Obviously, we can't afford to test every operation and every pig that's out there. It'd just be too expensive. So when we look at who to target, we want you to target definitely sick pigs. Target your at-risk practices. So garbage feeding, outdoor raised, show swine, or swine that are moving from premise to premise frequently. These practices have an opportunity for mixing of swine and diseases and the potential for foul mites through human interaction and other equipment that they're coming in contact with. Also look at your operations that are in close contact with feral swine, and then obviously your networks where pigs are moving from one premise to another through networks and commuter herd type agreements. Swine staff has 5 items to emphasize within the swine program cooperative agreement section. The first is every state needs to conduct some active surveillance, which includes activities to look for African swine fever, classical swine fever, swine brucellosis, pseudorabies, and swine influenza A in swine, whether your state is the largest or smallest swine producing state. Second is performing Swine Health Protection Act activities as required by state and federal regulations for disease prevention, including active searches for illegal garbage feeding and submission of monthly swine health protection activity reports. Keep in mind that even if your state does not permit garbage feeding, you must continue to conduct active searches for illegal activities and submit those monthly reports. Continue submission of annual swine activity reports and search for ethnic undocumented swine production or swine garbage feeding, training and response for swine fat activities, as well as monitor markets for ID and premises reporting, and continue to advance relationships with your swine producers, swine veterinarians, swine laboratories, and your associated swine industry within your state. Note that states may not utilize swine health funds for purchase of laboratory equipment. For reporting and expected outcomes for your swine activities, it's important that for swine pseudorabies and brucellosis non-negatives, you continue to keep those cases up to date in EMERS. For African swine fever and classical swine fever, depending on the source of those samples, you'll be using the comprehensive lab submission module or MICO to enter surveillance samples. And then for your FAD investigations, those will continue to go into the EMERS portal. Be sure that you're following up on laboratory tests that are positive for program disease or FADs needed to be submitted to VS, and that everything gets entered into EMERS appropriately. Continue to supply the monthly swine health protection summary data to VS, and this is now moved to EMERS as well. And then complete your monthly NARS reporting through the InnoRad NARS web reporting system as needed. Since 2016, swine staff has been working to move towards more targeted sampling of high-risk herds when sampling for pseudorabies and swine brucellosis. What we're asking is for states to assess within state industry structure and develop relationships with higher risk outdoor production operations and their processors to develop sample collection protocols for pseudorabies and swine brucellosis serology testing of at-risk herds. This is in addition to your regular cull, sow, and boar testing that happens at larger slaughter plants. This chart illustrates why swine staff develop surveillance-based alternative sampling, or SBAS sampling. Back in 2012, we were doing somewhat random testing of all sows going to slaughter. The unfortunate result is that 90 to 95% of the pigs we were testing represented in this pink or gray bar here were mostly commercial high biosecurity, low or no risk pigs. The only high risk pigs being tested were a very small percentage represented down here that just happened to be selected among the lower risk pigs. So in 2016 to 2017, we developed new surveillance where we cut back on the random testing and started surveillance-based alternative testing of higher risk swine herds. Testing still occurs at the Kentucky Federal Brucellosis Laboratory. Samples are differentiated on the VS Form 4-54 by indicating SBAS on the sampling form when shipping samples to the Kentucky lab. This targeted surveillance gives a higher chance of targeting higher risk pig populations where swine pseudorabies and brucellosis may be going undetected. In addition to SBAS sampling, representative cull sow surveillance continues. You'll notice that it's dropped from the original 5% of swine inventory in a state to around 1 to 5% based on risk within the state. Swine staff continues to assist in setting up collection algorithms, and the laboratory monitors the sampling through SCS LTE. At this point, the representative cull sow surveillance is more of a national function and not so much part of the cooperative agreement process for states. This table shows SBAS targets by state. You'll find the targets on in the swine section of the recipient guidance. In general, targets were set for each state based on swine population within the state and risk for contact with feral swine population or the level of backyard production, which swine staff feels is in general a higher risk activity. The total target for the nation is approximately 11,000 samples. Remember, SBAS targets are not specific requirements. They're just targets that we're encouraging states to try to reach. Shipping, testing, and reporting is all covered by the Kentucky Federal Brucellosis Laboratory provisions, so you don't need cooperative agreement money for this surveillance. State costs are related to making contact with producers and/or markets to get sample processes set up. State testing won't be supported out of cooperative agreement money if states choose to do it at their local laboratories. Most of you are aware we began a combined ASF-CSF hemorrhagic surveillance program as of June 1, 2019, expanding our over 10-year-long CSF surveillance. As you look at where you want to sample, we have 4 surveillance streams to target: garbage feeders, backyard higher risk herds, coal markets or buying stations, and FSIS slaughter condemns with reasons consistent with hemorrhagic disease, primarily septicemia, erysipelas, and deads on arrival, or high volume of deads in a lot. You should not collect samples unless they can be traced back to the farm of origin. These samples can be entered in either the Comprehensive Laboratory Submission Module or MICO. If states need help navigating the systems, please contact swine staff for training and assistance. Alternatively, if you have a network associate in your area, you can contact them for assistance with the systems. If you can identify incentive programs, such as supporting necropsy expenses or other endemic disease testing that may encourage submissions from high-risk farms, please feel free to consider including such activities in your cooperative agreement. A new ASF-CSF field collection manual was distributed in August of 2022, reflecting enhanced surveillance efforts following the ASF detection in the Dominican Republic. You can find your state's targets in that manual, as well as the designated laboratory to send samples to if you have a target. If your state is not listed as having a target, you can still collect samples for active surveillance. Contact swine staff to determine which known laboratory to submit your samples to. Again, focus on higher risk swine where possible: garbage feeders, coal sow markets and buying stations, slaughter plants receiving high risk swine, and even the sick pigs. Swine staff is happy to work with states to adjust targets as necessary if you have suggestions or ideas on swine populations to target. We get a lot of questions from the swine industry regarding what we are doing about the threat of garbage feeding. No metrics are associated with sampling garbage feeders, but we definitely want to continue to get them reporting any mortality or disease events on their operations, knowing they will get follow-up testing for program diseases. Keep in mind that you're required to continue to report monthly on your Swine Health Protection Act activities, and that's all being completed through the EMERS system. Finally, the last area we want to emphasize in states dealing with a high incidence of vesicular lesions in swine, I know there are approximately 8 to 10 states dealing with this on a regular basis, is that we will offer some financial assistance to these states. In these cases, it's often determined that the vesicular lesions are caused by Seneca virus A. We recognize that the foreign animal disease investigations at these slaughter establishments are labor-intensive and costly, and we want to allow a limited usage of swine funds through the cooperative agreement to supplement extraordinary foreign animal disease investigation-related expenses at these high-incidence facilities. It's only a line item for those states experiencing high incidence of foreign animal disease investigations at slaughter establishments. We also would ask that you explore ways with your VS FiOps partners on how to reduce the incidence of these lesions at plants, and look at source farms as a possible way to control these investigations. Thank you for your continued collaboration in the cooperative agreements and in swine health programs. Please reach out to the swine team if you have any questions.